Yeah, friends, now I am going to demonstrate you the anterior drawers test, which is the very important test for anterior cruciate ligament injury. Take for example, this man is having a left-sided anterior cruciate ligament injury. First, what you should do, flex the knee joint to 90 degrees like this. Rotate the foot 10 degree externally. Now, the examiner has to come and sit over the foot like this. With both the thumbs, keep it on the tibial tuberosity and your all other fingers wound round the calf muscle. Now, just give anterior pull like this. If anterior cruciate ligament injury is injured, you will have a soft end point. That is the perception. Only the person who is testing can perceive that. Should not see the movement. He will perceive a soft end point which says that anterior cruciate ligament is damaged. Why I am flexing to 90 degree in this position, sitting over the foot? I am sitting over the foot. My weight will stabilize the tibia. He is lying supine. His weight, patient's weight will stabilize the femur. So, when you do like this, if ACL is gone, you have an anterior translation or EC, that's called soft end point. An anterior translation, the soft end point. This is the correct method to do anterior drawers test. Coming to the next test, Latchman test. Latchman test. Here the patient is in supine position. Knee is flexed only to 30 degree. Examiner places the hand behind the tibia with the thumb on the tibial tuberosity. Other hand is placed on the patient's thigh. More than 2 mm of anterior translation associated with soft end field considered positive. Okay, this is called Latchman test. You see the animation. See how to do an Latchman test. This is how we should do an Latchman test. Okay, I will do the live demonstration. Please watch. Okay, dear friends, now I am going to demonstrate Latchman test, which is the gold standard test, best test for anterior cruciate ligament injury. Okay, so how to do that? For example, just imagine that he is having a right-sided anterior cruciate ligament injury. Flex the knee joint to 30 degree. So, when you flex the knee joint to 30 degree, when I keep my thigh underneath his thigh, roughly this flexion is up to 30 degree. Stabilize his thigh with my one hand and move like this. I had shown in the animation also. This is lively how we should do a Latchman. If Latchman is positive, there will be anterior translation and soft end point like your anterior drawers. Why I am telling this test is more superior test than your anterior drawers is, you are flexing only 30 degree. So, this will not hurt the patient more. When I flex it to 90 degree, it will hurt him more. In anterior drawers, I am flexing to 90, so it will hurt the patient more. Latchman, I am flexing only to 30, so it will hurt him less. Reason number 1. As I said earlier, doorstep phenomena is there in anterior drawers. So, when there is associated meniscal injury, that will be false negative anterior drawers. In Latchman, that is not a problem. Even there is associated meniscal injury, 30 degree flexion, doorstep phenomena cannot happen. So, whether it is associated with meniscal injury or an isolated anterior cruciate ligament injury, Latchman will be 100% positive. That is why this is a superior test and this is the gold standard test.